everyone. Thank you so much for joining us today. My name is Lori Marie Peixoto, and I am the Director of Strategic Partnerships and Education here at NeedyMeds. NeedyMeds is a national nonprofit organization. Through our toll-free helpline and our website, we connect patients to programs all over the country that will help them pay for healthcare expenses, including but not limited to medications. So we have a very special guest presenter today who I will introduce in just a moment. But before we begin, I just want to go over a few housekeeping tips. If you have any questions, please type them into the questions bar in your control panel, and our guest or I will answer your questions at the end of the presentation. This webinar will be recorded and placed on the webinar library page on the NeedyMeds website. It's also a resource where you can access other webinars on other topics, including our standard overview webinar demonstrating all of the resources on NeedyMeds website. So you've got the webinar library page when you have a moment. You'll find that under the Getting Started tab on the NeedyMeds homepage. And lastly, I will provide my contact information at the end should you have any other questions for me. And also, I believe our guest will provide contact information for her at the end as well, should you would like to request a copy of the presentation. And so with that, let's begin. So thank you again for joining us today. In honor of Men's Health Awareness Month, we thought it would be appropriate to have someone talk about prostate cancer, which affects millions of men all over the country. And so we are very pleased to introduce Ivy Ahmed. Ivy is the Director of Patient Education at a nonprofit organization called Zero, the End of Prostate Cancer. Zero is an organization that will not only provide you information so you can make informed decisions about your care, but they'll also direct you to support and resources that may be valuable to you if you or a loved one has been diagnosed with prostate cancer. We're honored to have Ivy with us today. Ivy holds a master's in public health, and as I said, she's the Director of Patient Education at Zero. She was personally impacted by cancer in her family, and that's how she became an advocate for early detection, research, and also demystifying the difficulties of cancer care. She is an accomplished public health professional specializing in educational materials for the cancer journey. Ms. Ahmed earned her graduate and undergraduate degrees from George Washington University, and she is a Master Certified Health Education Specialist and has worked in the cancer community for more than 12 years. So thank you so much, Ms. Ahmed, for joining us today. I'm changing the screen and passing the mic to you. So bear with me for one moment, please. Oops.
Hello. Thank you so much. Thank you so much, Lori, and everybody at NeedyMeds. We certainly appreciate the opportunity to be with you today and to present to your constituency. We're very excited to be here today. So make sure everybody can hear me, and then I will go ahead and get started.
Thank you so much. Thank you, Ivy. We're delighted.
Okay, perfect. Good. So I'm going to start off by talking a little bit about my organization, and our name really is our mission, and that is to end prostate cancer. We really lead the fight in prostate cancer in many different ways, including increasing awareness. We have quite a few activities in the community, and I just want to tell you about a few of them and certainly encourage you after the program or at any time to visit our website to learn more about the programs and services that we offer. We are very well known for our Run Walk series. We have more than 35 events throughout the communities. We partner with urology practices, oncology clinics, and local community groups to be able to raise awareness and research dollars in local communities. We have our own research fund, and we support clinical research. We're looking for new methods for early detection, as well as new treatment options. We advocate on Capitol Hill for prostate cancer funding and other issues that are relevant to the prostate cancer community. We have patient education and support, which is what I'm here doing with you today. as well as a robust online education program. And we also do webinars, and we have brochures that are available that we're happy to send out to people free of charge. We also have a patient copay assistance program for men with advanced prostate cancer. With that, I'm going to get started and talk about our agenda for today. We're going to cover what prostate cancer is looking like in the States today, what is risk, diagnosis and genomic testing, what it's like when the disease starts to progress, and what the sort of different stages of disease are, and what are the treatment options, some clinical trial information, and then I'm going to switch gears a little bit and talk about supportive care and living with cancer, and then certainly opening it up for questions and answers. And definitely want to start off with letting everybody know I'm not a clinician. I'm a health educator, and so we won't spend a lot of time talking about treatment options, but there's a great deal of information on our site, and certainly want to help people be able to advocate for getting the best information for themselves to make the right decision. So today, according to the American Cancer Society, it appears that in 2015, prostate cancer is going to be the most diagnosed cancer in American men, with more than 220,000 cases predicted. That actually, is considerably higher than obviously lung and colorectal cancer. And so it's a far-reaching and incredibly impactful disease on many, many American men. The ACS predicts that there'll be nearly 30,000 deaths this year as well. And they put out this statistic set every year and really gives us an opportunity to see where we have come. We've been fortunate that we have seen some decreases in the estimates, but we still find this disease is very impactful across the board. We'll talk a little bit about incidence rates. And incidence means number of new cases of disease and where those diseases are coming out in the states. So based on the last set of data that came from SEER, we see that the highest rates of new cases are seen pretty much throughout the country in different locations. DC, followed by Utah, Louisiana, Delaware, and New Jersey, also with New York and Michigan close behind. When we look at the actual distribution beyond that, and within how the races of how the disease, incidence rates for the disease, see that all races, the incidence rate is 142.1 per 100,000. And that's a pretty high number. And then that followed, unfortunately, very high African American men, and it's more than 1.6 times the rate for African American men at 219.8. White men follow shortly behind that at 133. So they're right below the all races tab. So there's definitely some disparity, and we at Zero and also throughout the prostate cancer community really want to spend a fair amount of time making sure that we're able to advocate in at-risk populations. And sorry, my slide won't. So the next exciting map is for age-adjusted death rates, and so we know where the most number of cases are going to be diagnosed, but taking a look at where the most number of men are going to die from the disease. Unfortunately, there's a pretty good cluster in the southeastern part of the country. Up DC, again, leading that number, but following closely behind is Mississippi, Alabama, South Carolina, Georgia. We also see an outlier in Idaho. We're not quite sure where that comes from, but we also see that those are areas where we really want to make sure we're able to provide education and empower and men that they have opportunities for the latest advances and highest quality care. In terms of how the distribution is for death rates by race, all races, the mortality rate for all races is 22.3. And unfortunately, again, we see with African American men that rate is more than double at 49.8. For white men, it is 20.7. So that does put African American men in a risk category of being 2.4 times more likely to die of prostate cancer. I'm having trouble. So now that we know where it is in the country, I want to talk a little bit about what is the prostate and what is prostate cancer. And so The prostate is a gland in the male genitourinary system, which means it's located behind the bladder and in front of the rectum. It's pretty hard to find. As you can see right here, it's pretty well embedded deep within the body in the organs. The main purpose of the prostate is to help control urine flow. It helps nourish semen and seminal fluid. And so it's essential also in erection and urinary continence as well. One of the other things that the prostate does is it helps to produces prostate-specific antigen, which is a biomarker in the blood. And it also helps to keep semen in liquid form so that sperm can swim. So now we know where the prostate is. And prostate is only found in men. So now I'm going to talk about risk and who is at risk for prostate cancer. Well, there are quite a few factors that play into determining risk. Obviously, as I've talked a little bit about, African American men are at significantly increased risk for the disease. And so it's very important to make sure that we're having those conversations in the African American community. Having a family history of the disease also significantly increases your risk. So if a man has a father or a brother who has been diagnosed with the disease, his risk increases. But also something to consider is if a man's son has been diagnosed and he has not, that's something we don't always think about. So it's important to remember that that also increases the risk. Unfortunately, aging increases our risk. It increases our risk many things, but it definitely increases our risk of the risk of prostate cancer. The lifetime risk for prostate cancer is 1 in 7 men will be diagnosed with prostate cancer. As men do age, that risk increases, and so we see the highest number of cases in men who are 70 and over, and that risk is 1 in 9. But the biggest, we start to see the most number of cases being seen in men once they're over 50, and then that risk continues to increase. Another known risk factor is exposure to Vietnam veterans who were in post-Agent Orange is a definite predisposition to developing prostate cancer and an aggressive form of prostate cancer, which is very unfortunate. Exposure to certain other chemicals also, like pesticides and herbicides, do also put a man at increased risk. There is a direct link with the BRCA gene mutation. That's the gene that's responsible for hereditary breast and ovarian cancer syndrome. And so if a man has significant breast or ovarian cancer history in his family, it's a good opportunity to have a conversation with the healthcare team and find out where their risk is with the disease, that there is any prostate cancer in their family as well. Diet has been linked with more aggressive cancers in men, and so it's important to really kind of pay attention to diet and making healthy choices. And those are the most common risk factors that we see in men for prostate cancer. Good news is that there are nearly 3 million prostate cancer survivors in the country today. So there's certainly great news, and I'm not trying to give grim information, but there's a lot of hope for men who are at risk and who have been diagnosed. So prevention is always a question people ask, but at the end of the day, there isn't any one proof thing that we can say to you will prevent prostate cancer. But we do know that making healthy choices helps to minimize your risk, and the phrase that we use in the prostate cancer community is, a heart-healthy diet is a prostate-healthy diet. And so that means, eating a lot of fruits and vegetables, being physically active and moving, doing some weight-bearing exercises, getting your heart rate up several times a week, all very important. And there's an interesting clinical trial that's being done around prevention for men who have a very low, non-aggressive cancer that's looking at a relationship between diet and prostate cancer progression, and that's called the Men's Eating and Living Study. And I certainly can give you more information on that offline. I think so it's a really interesting study, and it's a great, just to show that there's a fair amount of work being done on that topic. So now I'm going to switch gears a little bit and talk about detection and diagnosis. We at Zero advocate for early detection. It is very important, but why? One, most prostate cancer is usually very slow growing. I think it's important to note that while most prostate cancers are very slow growing, that doesn't mean that there aren't some that are very aggressive and can cause significant harm. But in many, many, many cases, It is a slow-growing disease. There are no symptoms with early disease, so unfortunately, it's important to understand where the risk is and then be able to monitor what your risks are. And more exciting, just like the 2.8 million prostate cancer survivors, there is nearly 100% 5-year survival rate for men who've been diagnosed with prostate cancer. So what that means is that if a man is diagnosed with prostate cancer today, he has almost 100% chance of being alive in 5 years. And obviously, there's other things that go into play in that, but it's a really good statistic for men who are diagnosed with the disease. So there are several tests that are on the market that are used in the early detection of prostate cancer, and I'm going to talk about the 2 that are recommended and what the recommendations are for early detection. So the prostate-specific antigen test, or PSA test, we talked about PSA, which we've talked about prostate-specific antigen, which is made by the prostate. And so that is a blood test which is done by a physician, and it measures the level of PSA in your blood. And it is a point-in-time test. It is not like a pregnancy test, but it's going to give you a reading of the amount of PSA in your blood at the time. And at this moment in time, it really is the only test that is widely available for use in prostate cancer early detection. The other test that is used in addition to the PSA test is what's called a digital rectal exam, and digital meaning the use of a physician's finger. He gloves up, he puts some glue on the finger, and inserts the left finger into a man's rectum to examine or palpate the prostate, and it really gives them a good idea based on shape or size, and because that's really the closest accessibility spot to the gland. The prostate should feel smooth, like the palm of your hand. It should be spongy and kind of bounce back. If there's a malignancy or a tumor in there, it certainly would most likely be, it's hard or bumpy and ridgy, and so it gives the physician an indication that there's probably something going on at that time in your prostate, and you may want to have a conversation about what are the next steps. In terms of prostate cancer screening and guidelines for recommendations for screening, there has definitely been some controversy. We as an organization have followed the NCCN clinical practice guidelines. And the NCCN is the National Comprehensive Cancer Network, and they put together a set of clinical practice guidelines that address screening, and they also address treatment guidelines. And they're well-respected cancer centers who come together and really put the best and the brightest and look at the evidence to make recommendations about treatment, and they have spread that out for screening. And so here's the guidelines in a very straightforward way. We advocate starting at 40 to have a conversation about your personal risk. If you're of African American heritage and your father had prostate cancer, most likely you're in a very increased risk category. So it's important to start, understanding what a man's risk is. And 40 is also, that point in life where you kind of take stock about what else is going on, and maybe it's a good opportunity to think about all your sort of health needs. Particularly with men's health, it's a great chance to figure, go back for a physical and start to make sure that you're taking care of yourself in the best way possible. Between ages 40 and 49, the recommendation is to have a baseline prostate-specific antigen test and a digital rectal exam. If that test comes back over 1 nanogram per milliliter, which is a very low number, then they recommend to repeat that in 1 to 2 intervals until 50. So we're talking about a 5-year span and a maximum of a couple of repeats. If it's lower, then to begin regular screening at 50. And so really the focus for screening is to begin at 50 with a PSA test and the digital rectal exams as well. If the PSA comes back below 3 nanograms per milliliter, then the encouragement is to go ahead and repeat that test every 1 to 2 years. If it comes back higher, or there is an abnormality in the digital rectal exam, there is an algorithm in place to encourage additional diagnostic model that's available. But it does mean that there might be something going on. PSA does tend to rise as men get a little bit older, so it's very important to have these conversations and talk with experts about what is appropriate for you. And then over 70, while the number of new cases increase over the ages of 70, it's still important to consider your own personal health and really talk with your physician to assess whether or not it's important to you as a patient, as a man who's activated and empowered about his health, to determine whether or not you want to have a PSA screening routine. So the most important thing we think we walk away with is that knowledge is power. So be informed and know your risk. Talk with your physician about your risk. I can't say it enough that if you have a family history or you're of African American ancestry, it's very important to make sure you have those conversations and come up with a plan that works for you. Some men really want to know everything about their health, and some don't. But it's your choice, and it's for you to be informed and make a decision based on what your health and what you want for yourself. So if an PSA is elevated or a man has a digital rectal exam, sort of a series of steps go into play around coming up with a diagnosis. And so with most cancer diagnoses, the process is to obtain a biopsy, which is a tissue sample that is taken by a needle, and a physician, a urologist will do this in his office. And biopsies come with considerable risk. It's not necessarily an easy procedure, and a physician has to go through the rectum to access the prostate. But if there is suspicion and a biopsy is chosen as the next step, several samples are taken from the prostate and sent to the pathologist's office. If it does come back as a malignancy, then another set of questions go on, and we work with the physician's team, your team, to understand how has it advanced, where is it located, how aggressive is the tumor, and it's time to ask a lot of questions and make some decisions about your treatment. But if you have been diagnosed with prostate cancer, there's some very exciting news available, that there are several genomic tests available for men, and what these tests do, and we talk about them on our website, what they do is they help the physician understand if the cancer is aggressive. They ask questions: will the cancer come back? What is the chance that this cancer is going to metastasize, or will it recur? Having that bit of information is super important because it can really help somebody who isn't sure about to have treatment or what type of treatment to have, to really feel confident in their decision. And really the goal is to decrease regret about any sort of treatment that somebody has had. Now, I'm going to talk specifically about prostate cancer. And, moving on, so now there's a man who was at risk, and he's been diagnosed, and he's had some tests done. You're going to have more tests done. But you want to understand your stage, which is the location, the grade, which is the aggressiveness, and what is the risk group, meaning what's the likelihood that the cancer is going to spread. So I always advocate for anybody who's diagnosed with any malignancy to learn about all of your treatment options. It might not be the right treatment options at the time, but what are all of the treatment options for prostate cancer? And what are the right treatment options for you, particularly with prostate cancer because of the location of the prostate. Find out about how your side effects are going to be managed. With treatment for early stage disease, there's always a risk of having erectile dysfunction or urinary incontinence as side effects. So as you're asking about those questions, and there's a lot of emphasis always on how do we get the cancer out and manage it, thinking about how it's going to play out afterwards. Then choosing your healthcare team, and you're in charge of this and moving forward and making decisions for yourself. So, and make a plan and ask questions and engage who you feel comfortable engaging. I'm going to talk just very briefly about staging. Staging is the location. Stages is stage 1 to 4. 1 and 2 mean the cancer remains in the prostate. Stage 3, the cancer has spread beyond the prostate, but it's still very close by, and it's in the lymph nodes or the seminal vesicles. And stage 4 means the cancer has spread to other organs, such as the bone. And at that time, it's called metastatic cancer. When prostate cancer spreads and metastasizes to the bone, you have prostate cancer that's in the bone. It's not actually bone cancer. Some people have trouble sort of making that distinction. The next important fact that you need to know when understanding your diagnosis of prostate cancer is grading, and that is done with what's called the Gleason Score. And Gleason Score range from 6 to 10. What it does is it helps to predict the aggressiveness of the tumor. By example, to a pathologist, and the pathologist takes a look at the cells there, and based on the way they look, as you can see in this type of an image here, they determine what the most common common pattern is, and they assign that number. So if they see the most number of 5, then there's the first number is a 5. The second most frequently seen pattern is a 4. Then you have what's called a 5 plus a 4, which totals to a 9. The categories, the numbers go from 6 to 8, 6 to 10, and 6 means that the tumor is pretty well organized and most likely won't spread. 7 is there's a chance you sort of fall on both sides. It could spread, but it may not be able to spread, and it could be aggressive. So it's a little sort of one of those places where you want to have as much information as possible. And Gleason's 8 and 10 certainly mean that there's a risk of significant aggressive spread, and that they will grow faster. This information helps your physician to add another set of information, which is your risk group. And the risk groups include very low or low-risk prostate cancer, which means that the prostate cancer is very unlikely to spread or to grow for quite some time. Medium or intermediate risk means that it's unlikely to grow or spread for a few years. So you have time to make a decision. You probably don't, you don't need to make your decision within the next 3 days. High-risk prostate cancer means that it probably is going to grow or spread within a few years, and that it's important to keep the factors in mind when you're making decisions about your treatment. When you go to choose your team, we recommend that you consider a multidisciplinary approach. And what that means is including the specialists that treat prostate cancer. Most likely the urologist is the one that gave you your diagnosis and did the biopsy. And the urologist they're experts. They do many different things in the treatment of prostate cancer, and particularly they do surgery. But there are other options for men to consider. So in understanding what your options are, consulting with a radiation oncologist, and then also a medical oncologist, because unfortunately, up to 40% of men who are diagnosed with early disease will recur. So you want to sometimes have in the back of your mind what's the chance of recurrence and how will you manage that. Some other folks to include when you're putting together your personal team to help you through prostate cancer treatment are urology and oncology nurses. These are folks who have wealth of information and expertise. They can help you prepare for treatment. They can help you manage side effects. Really, those become advocates in the for you. Your primary care physician, because that's who you'll go back to working with on a regular basis. Oncology social workers are amazing assets to anyone's cancer journey. They not only are they trained and skilled in specializing in helping people manage the emotional impact of any cancer, but in particular prostate cancer, because there's so many complications and it's such an isolating disease. But they also can help people navigate the healthcare system. Physical therapists are key, particularly if you're having treatment to the pelvic area. They can help you strengthen that area, and then after treatment, they can help you recover from whatever treatment you've had. Consider a nutritionist. Usually a cancer diagnosis is a call to action for a lot of people, and it gives them a chance to say, they might want to make some changes in the way they live their life, and so a nutritionist can help them. And that's really an important team to have together, and make the team your own. So I'm going to talk specifically about prostate cancer itself. And so in both early stage disease, which is disease that's located only in the prostate, and then more advanced disease. And so early stage prostate cancer means that it's confined to the prostate. The intent of the treatment is to cure it, to remove all traces of the cancer. There are several treatment options that are regularly recommended. Active surveillance, which is a disease management approach. I'll come back and talk about all of these. Radiation, which can be done internally and externally, and then surgery to remove the prostate. So active surveillance is a management of the disease for men who have very non-aggressive, slow-growing prostate cancer, who are comfortable with knowing that they have cancer in their prostate, and they can continue. Sometimes just knowing you have cancer in your body is very, very stressful, causes considerable emotional distress, and people, it doesn't matter, they want to make sure that it's treated and there is no chance of that cancer impacting their lives. There are 2 types of radiation therapy. There's external radiation and internal radiation. And external radiation is done by a radiation oncologist, and a linear accelerator is focused at the prostate and with our beam, and the focus is to kill the prostate cancer cells and the prostate where it is. So the prostate actually stays in place, but it is killed, and then alongside of it with all of the cancer goes as well. Internal radiation, there's 2 different types. Internal radiation is called brachytherapy, which is the word people have probably heard, but there's low dose and high dose. So not to get too complicated, low dose radiation, low dose brachytherapy is the implantation of radioactive seeds into the prostate. Those are implanted by a physician, and then they actually stay there permanently, and they give off some radiation, and that the purpose of that is that the radiation will kill the prostate cancer where it is. And those seeds stay in place when they're no longer radioactive, and the man goes on living his life. And it's a great option. High-dose radiation is a similar approach where radiation is put into the prostate, but it's actually a one-time shot, and it's put into a prostate with a series of catheters. So the radiation is injected into the prostate, and so nothing is permanently placed. So both of those are options for internal radiation. Surgery means the removal of the prostate, and there are several different types of surgery that can be done, but one of the things people hear about frequently is robotic surgery. And what does that mean? And it doesn't mean that the robot's going to do the surgery, just that it's a tool for the urologist to use to really improve the precision in being able to remove the prostate. And so it minimizes the goal of using a robot to perform the surgery is that it minimizes tissue tear or damage to healthy tissue. One of the things that is important always, and I talked just a little bit, and we'll go back to, is that some of the side effects that come with the treatment for early stage disease are very impactful. Urinary incontinence, which is the leaking of urine from your bladder, and erectile dysfunction, which is the inability to achieve or maintain an erection, are both significantly life-impacting side effects. And so it's important to understand how where your disease is, what the treatment options mean for you, and understand how you'll work with your healthcare team to manage those symptoms when they happen. Many men recover fully, and some men don't. So it's very important to just know that that's a conversation to have, and not to be embarrassed by it. You're not, certainly, if it happens to you, you're not the first person. Another side effect that happens with that is known to happen with radiation is also rectal incontinence. So something to think about in terms of treatment decision making. I'm going to shift gears to talking about the early stage disease to more advanced disease. And in thinking about that, locally advanced disease is that which has spread just beyond the prostate into the lymph nodes or the seminal vesicle. And prostate cancer, the whole purpose of prostate cancer likes to feed on testosterone. That's the food for prostate cancer. So locally advanced prostate cancer is frequently treated with the options of radiation or surgery that we just discussed, but another tool is introduced, and that frequently is what's called androgen deprivation therapy. What androgen deprivation therapy does is it stops the body from making testosterone. And so introduction of stopping the testosterone production means that it helps to starve any prostate cancer cells that are there in your body. So if you had surgery and you go on the therapy for a while, or you have surgery to stop the production of testosterone, then they give your body a chance to recover and heal, and hopefully if there's any prostate cancer cells, they're not being fed. Sometimes, however, the prostate cancers continue to grow, and that is evidenced by a rising PSA in a man who's had treatment and has been on androgen deprivation therapy. And if that happens, that's what's called castrate-resistant prostate cancer. And so it just means that the disease is progressing, and it's an opportunity to make sure that you're having conversations with your healthcare team about how best to manage that. There's quite a bit of discussion in the healthcare and the medical community about how to best manage it, but it's certainly an important conversation to have. Stage 4, or metastatic prostate cancer, is prostate cancer that has spread beyond prostate to other organs. 90% of prostate cancers that are metastatic are going to spread to the bone at some point. And unfortunately, prostate cancer that spreads to the bone is pretty painful for most men. And so it's very important to be on that early and figure out how best that can be managed. Treatment is done for men with metastatic disease to manage the disease, to limit or slow the spread, and really it's palliative care to manage pain and discomfort. What is very exciting in the prostate cancer community is that many men live for quite some time, meaning 5+, 10+, 15 years with advanced disease because there's new drugs coming down the pike So it's very important to have hope throughout the entire process of being diagnosed with prostate cancer. I'm going to talk very briefly about some of the treatment options that are available for advanced disease, and you can certainly learn more on our website, or you can download one of our brochures, but there's some very exciting advances that are available for men living with advanced prostate cancer. Immunotherapy was the first therapeutic vaccine was actually approved in prostate cancer, and actually at this point it is still the only one that is approved. And what this treatment does is called Sipuleucel T, or Provenge, and what it does is it activates the man's immune system to and educates the man's immune system by educating his immune cells. So immune cells come from the man's body, and they're sent to a lab, and they're educated against some of the biomarkers on the outside of the tumor cell, and then they're infused back into the man. And the idea is that your body is able to now fight the cancer. It can't hide, it's educated to it. And so they're trained, and it starts a fight. Another very exciting tool in the fight against prostate cancer is hormone therapy. And hormone therapy, what it does is it alters the body's hormone balance to prevent cancer from growing. And again, it's most frequently used at either in the advanced stage, during the advanced stage. There's some new hormone therapies on the market. There's 2 new drugs. What they do is they also block enzymes and or proteins from making testosterone. And the two drugs, enzalutamide and abiraterone, or Xtandi and Zytiga, are new in the past 5 years and have been fantastic resources for men with advanced disease. Those 3 treatments really have very minimal side effects. Radiation is also something that's used in the treatment of advanced prostate cancer. If a man has, so external radiation is done, if a man has bone metastases, let's say in his arm or his leg, they're able to use external radiation to zap it. And then the other option is for men frequently who have quite a few bone mets is a new treatment called Xofigo, or radium-223, that is injected into a man over a period of 6 cycles, once a month, and the radium goes into the body, and it is taken up in the bones, just like calcium, and it delivers a little smart bomb, and it works to kill off the prostate cancer that is growing in the bones. And so that's very exciting. That it's called several drugs are in that class, but that particular treatment has been proven to increase life expectancy as well. Another option is chemotherapy. There's several chemotherapies on the market. For the most part, the taxanes are used and are generally mild for men who are living with advanced prostate cancer. And there's a lot of research going on right now in how best to use these drugs, what's the right sequence in them, because a lot of these changes have come onto the market place to help treat patients in the past 5 years. And so I want to talk a little bit about clinical trials where, a lot of these treatments that we've talked about have come from. There's so much work going on that's very exciting. There are several types of trials, but therapeutic trials are really looking out there to find effective medicines and combinations that can prolong life. Supportive care trials, understanding how exercise and lifestyle, and understanding quality of life studies, really helping to decrease stress or complications from the disease. We recommend folks who want more information about clinical trials to go to clinicaltrials.gov or go to the National Cancer Institute's clinical trial site. We do have several trials listed on our website, on the Zero website, specifically for men with prostate cancer and their therapeutic trials. So I'm going to switch gears and talk a little bit about affording care and how you can use all this information while you're trying to figure out what treatment to have, who's on your team, and how aggressive is your cancer. So all of these things are swirling through your mind and your family mind. How do we go? What's next? Unfortunately, finances are key to managing disease, and so I encourage people to start talking about finances at the beginning and how much the thing's going to cost, understanding what your insurance is going to cover, what does your out-of-pocket look like. It's never unfair to ask the question: is there another effective treatment that could cost less? What are the copays? Several of the treatments that I mentioned are oral therapies; they're pills, and so they're not covered under like an infusion or a hospital coverage. And so having those conversations, men who are being treated for radiation, how much are the copays going to be? And as you start to gather this information and pull things together, you're going to find out if your hospital or the physician's office where you're being treated has financial services or a financial counselor who can help you understand what the costs are going to be, and then beyond that, make a plan. So just as you're making plans about treatment, making plans about how you're going to manage the cost of care. One important thing with health insurance is, talking to your health insurance provider. I mean, they're going to be your reimbursement face and making sure that your doctor is in your network. If your doctor isn't in your network, how does that work? What are the costs associated? Learning what your out-of-pocket deductible are. Many insurances have a case manager who can help you navigate this aspect of it, and sometimes those case managers are also clinicians, so they can also help with some of the disease management piece. Fortunately, most medical practices are on the ball, and they help you pre-approve and understand what's going to come down the pike in terms of billing, but it's always important to ask that question. And it's don't think that if you ask a question about cost that you're going to get poorer care. It's a very common misperception. People frequently fear that. If I ask if they're going to think I can't afford anything. And a lot of the evidence out there and the research that's been done on that shows that that isn't the case. It doesn't make it any easier. I'm not saying it's the easiest thing in the world to do, but it is a great thing to be able to have that open dialogue. And the physician may have wanted to ask it, but just didn't think to do it. And so really, including that as part of the conversation. If getting health insurance is on your radar, there's some great resources out there. The healthcare exchange, the marketplace exchange that was implemented by the Affordable Care Act makes insurance accessible to all. And there was an important ruling that came out today, which means that if you are getting subsidies from the federal government to help offset the cost of your insurance premium purchased through the healthcare marketplace, that you would continue to get that subsidy. So that's very exciting for folks who are able to get some support for that, being able to afford their insurance. Talking about your network, ask your doctors. If your bill is going to be $10,000 and you don't have $10,000 cash sitting around, find out if they can waive your copay. Will they give you, will they reduce the rate? How can other things be done? Find out about deductibles. Are you eligible for other supplemental insurance plans or supplemental resources? And to pay for that, are there copay programs? Are there other assistance programs that can help you? Another thing to think about is, cancer, some of the changes that happen because of a cancer diagnosis. You might miss work. You might lose your job. You might not be able to work at it. And so what happens is you want to think about those things and be proactive. You are not required by law ever to disclose your health status or diagnosis to your employer. So the good thing is that you really are in control of what gets shared about your health status. If for some reason you lose your coverage, you can purchase your health, the care that you are receiving now, the insurance coverage, at a separate rate through a plan called Copay. And not all employers offer it, but many do. There's very specific little stipulations as to who must offer it. And so it's good to find out if that's accessible. And again, enrolling in the marketplace after loss of employment or loss of COBRA. So again, thinking about what changes might come to you based on living with a diagnosis of prostate cancer. Some of the other resources that are available, one is knowing about Copay Assistance. And so one of the programs that we have at Zero that I mentioned very quickly was our Copay Assistance program. We do this in partnership with Patient Access Network, and we provide up to $7,500 for men with castrate-resistant prostate cancer. They have to be being treated with an FDA-approved therapy for prostate cancer. And it's a very generous program. You can certainly learn more about it on our website, or you can also access it from the Patient Access Network Foundation. There's several other Copay Assistance foundations that are available and provide support. Sometimes funds run out of money, so if you check them at the beginning of the month, they might be recharged, and that's a big challenge. Sometimes you just have to stay on it to see if the fund is available for you and if you are eligible. And in terms of pharmaceutical management with pharmaceutical drugs, many companies do have assistance programs. So depending upon what their requirements are, you may be eligible to receive discounted drug or free drug, and that can always be a huge help, considering that some of the drugs have significant copays associated with them. I'm just going to wrap up quickly and talk a little bit about survivorship and some of the resources available within the cancer community. And hearing the words "you have cancer," no matter who you are, or what they are, what they're about, is always can be very scary for somebody. And what that does is it introduces a new normal for you and pretty much everybody in your life. Sometimes changes are short-term, and sometimes they are life-altering, and everybody has to readjust. And so it's very important to just be open and honest with yourself and those that are close to you about how you will manage through the process. And it's never hurtful to ask for questions, ask for support. Many people experience unwanted aloneness, loss of control, and fear. These are normal things for people, and some people have great support networks, or some people just take it in stride. It's your experience, and we certainly encourage you, but there are a lot of resources out there. So take advantage of free information, financial support resources, practical support. Do you need help with transportation? If you're having radiation therapy, you have to go every day for 6 weeks. How is that going to work? Who's going to get you there? And also emotional support. There's a lot of organizations out there that help provide these services free of charge. And then thinking about survivorship. And survivorship means something to everybody different. It's something different to everybody. But it is important, and it's a personal decision for somebody to call themselves. So some people with metastatic disease call themselves survivors, and some don't. I defer to the patient, the survivor himself. It's really how you want to self-identify. Some of the issues to consider are risk of recurrence. Up to 40% of men who've been treated for early-stage prostate cancer will experience recurrence at some point, and that can be scary. And sometimes planning for that at the initial outset can really help to mitigate some of those fears. Active care planning. Have a conversation with your doctor and say, what is the plan for treatment? What are the drugs that I have options for? Again, remembering that many men live with many, many years with advanced disease, and understanding how those survivorship issues can impact you and your loved ones, so when you're making your treatment decisions. And knowing that there are nearly 3 million prostate cancer survivors in the country today, and that's really hugely helpful for many, many men who are going to be diagnosed this year, and that we certainly are here as an organization to help people navigate that disease. There are plenty of other organizations providing support in the cancer community, and then also to people impacted by prostate cancer, and I certainly encourage you to take advantage of all of the resources that are available that you have an interest in. So I'm going to just tell you briefly about a few of the resources we have, and then I'm going to hand it back over and open it up for questions, I think. So some of the resources that I mentioned we have on our website. We do have a monthly e-newsletter that you're welcome to subscribe to. You can participate or volunteer at one of our one walks. And we have a program called Zero's Heroes, where you can certainly share your story about how prostate cancer has impacted your life. Noted here is my contact information and my colleague, Alice Lee. We are the education department at Zero. I'm very proud of that. So you are welcome to contact either one of us at any time. That information is on our website. I'll also, our slides will be available in PDF as well. And so with that, I'm going to turn it back over to Marie-Laure and let her take that over.
Oh, this is great. I love your slide. So thank you so much, Ivy. That was an incredible presentation. Not only was it full of information that I did not know, and it was so comprehensive, but it's also just such a beautiful visual presentation. It's really, really nice PowerPoint.
Thanks.
Thank you for all this.
Alice.
Oh, thank you too, Alice. you both did a great job on this. That was, yeah, I learned so much. I did not know hardly any of that. But there are some questions that have come in, and so the first one is, would you please give some examples of questions that if you were a patient or the family member of a patient who was recently diagnosed with prostate cancer, can you give an example of some questions that the patient should write down and then take into the doctor's office so that they ask all the questions they need to ask, what would be some good questions?
Yes, so that's actually, and that's a wonderful question. And one of the things we do have on our website is a list of questions for, we have a section dedicated to men who are newly diagnosed. And so I actually have a downloadable list of questions that people can ask. But some of the questions are, what is my stage? What is the grade? What are my treatment options? I certainly, where can I get a second opinion? If a physician, says, well, this is the disease, and they say, here my recommendation is surgery, that's great, then you can say why. Why do you recommend this versus any of the other options that I might be available? And, why is an amazing question. There's a lot of freedom that actually comes with that. I think it's important, particularly for the healthcare team, some other questions that somebody could ask are, again, I go back to what are the side effects that I can expect from each of the treatments that we've talked about. And another question really is helping a man to say, write them down. What are the treatment options, and what are the, what the data say about men who have my characteristics, my age, my ethnicity, and my general health status. What does the research say about, how each of those different treatments work for me? So I hope that's helpful, but I definitely encourage you to go to the website and download that list of questions. And we're always looking to update that, so if you have any additional to add, feel free to send them our way.
So that's a terrific resource, and I hope that people will check that out. I think certainly when you have a serious diagnosis such as cancer, I think, first there's getting over the shock and acceptance, but then you sort of have to pull yourself together and try to cognitively process everything and try to find out all the information you need. And I think sometimes for patients, what I hear in my work is that sometimes they feel intimidated or maybe out of line asking for a second opinion or asking doctors to explain the reasons why they're suggesting what they're suggesting. Can you offer anything to embolden patients to be more assertive with their care providers?
I certainly can, and those are all great points. And it's important to just remember that I think most people, almost every person, experiences some range of emotions around that. That it's the doctor, they went to medical school, I didn't. But I find it particularly empowering to remind men that jumping into a decision, particularly in early stage disease, jumping in and saying, oh, we've just got to do X, we've got to do Y, and not thinking through is really important, because we're talking, you have the potential of not being able to have an erection. And so that's a significant life-altering factor, because if for a younger man in his late 40s, or, in their 50s and 60s, you might not, you're still going to have your libido, but the mechanics might not be working, and that's pretty significant, motivator many times to say, ask for a second opinion, ask how confident they are, ask all these questions. And at the end of the day, this is your body and you're in charge. We work with some amazing physicians, I know you all do, and everybody in the healthcare space does, but it's your body and you have to go home and live with it. And decisional regret is a word that we frequently hear, that if I had only asked more questions. And when it comes to the potential of experiencing side effects like long-term urinary incontinence or erectile dysfunction, those are aspects of men's health that men generally don't want to have decisional regret around. And so if your physician makes you feel uncomfortable because you said, I'm going to get a second opinion, then most likely you really need a second opinion. And I think that's something that everybody says, because again, it goes back to you're the consumer. You wouldn't buy a car without maybe test driving 2 or 3 of them, without looking at a couple of different ones. And again, you want to take that same approach to finding out how you can take care of your health. And I'm not saying that it's easy. These are all things that I say to people, and sometimes I can act out myself, and sometimes I don't. But I think the more that we say them, and the more that we hear them in our heads, I always encourage people to bring a loved one or a friend with them to doctor's appointments. If your doctor's appointments are extremely stressful, you can offer to, as a physician, if you can record the conversation, bring somebody along who can write down the things that are said, so you can go home and process them. Very important a lot of times to go with questions, because sometimes the question, because most people forget, myself included, but when they get there, like, oh yeah, everything was fine, and then you go home and you're like, oh yeah, right, I was having this pain and all of these things. So really taking advantage of the resources, those around you, and just remembering that you have to ask, and everybody's entitled to a second or a third or a fourth opinion. Most insurances cover that, and there is no reason to not seek one.
A question came in from Lisa, and she's asking, if my dad and both brothers had prostate cancer, should my son be concerned?
Yes, in that he is at increased risk because his grandfather and 2 uncles have been diagnosed. So the rule of 10 applies here, so that, but his father hasn't been diagnosed, and so. But if they were diagnosed young, it's important to younger to make sure they start having that conversation at least 10 years before one of her brothers were diagnosed. But definitely your son will be at increased risk because there's a history in the family.
And you mentioned earlier, there's a question pertaining to the MEAL study, the MEAL study, and you mentioned that there were lifestyle factors, and one of them was diet. Were they, this is just a curiosity of mine, were they talking about a plant-based diet to prevent or slow down the progression of prostate cancer?
It's actually a bit of a behavioral modification study. So what they're doing is they're looking at, it's for men who are on active surveillance, and so they have early stage, low risk disease, and it's an intervention that's being done with their food journaling, and so it's a little more retrospective. So they're not doing any specific changes, but one cohort is just journaling and receiving a standard newsletter, and the other cohort is receiving nutritional counseling. So we're things like healthy, adding fruits and vegetables and cutting out fats and increasing fiber. All of those pieces are being put in, and so to see if that counseling is adopted, and then if there's any impact in disease progression.
And Ivy, if someone were to want a copy of your presentation, should they email you?
Yes, they can certainly email me, and I'll be happy to send it out. We have it in a PDF.
And would you mind putting up your contact information one more time before we conclude?
Not at all.
Thank you.
There it is.
This is fantastic. So if you'd like a copy of Ivy's fantastic presentation, here's her email address and also her phone number. If you have any questions that come to mind later on. Again, this website is recorded and it will be placed on the NeedyMeds website under the Getting Started tab in the page that's called Webinar Library. And we have other webinars in there that you may want to check out as well. So for just a moment, I wanted to go back to the website and show the folks in the audience some resources on the NeedyMeds website that may help if you or your loved one have a prostate cancer diagnosis. So here's the NeedyMeds homepage. If you are looking for a particular medication, as Ivy mentioned, there are resources for patients who cannot afford their medications or other healthcare expenses. The first place you want to look is the Patient Savings tab right here. And you can search for a brand name drug or a generic name drug. And this includes chemotherapy drugs as well. And if it has a patient assistance program through the pharmaceutical manufacturer, it will show up in these databases. And these databases are kept up to date. The other place I would recommend looking for financial assistance is the diagnosis-specific section here. So right here where it says diagnosis-based assistance, you can search by diagnosis, where you live, or the name of the program if you know it. Diagnosis-based assistance will provide financial help for things like traveling expenses, house cleaning services, wigs for chemotherapy patients, assistive technology, durable medical equipment, testing and supplies, co-payment reimbursement, and so on. And so, for example, if you look by diagnosis, you could look under P for prostate cancer, And you'll see we have 13 DBAs for prostate cancer at this time. You can also look for more assistance by going to the diagnosis of just cancer in general, and that will pull up many more resources that you can also check out. So for cancer in general, there are 146 DBAs. And again, I found that by going to the Patient Savings tab. We also have camps and retreats and scholarships, which you can search for a diagnosis of cancer as well. So I encourage you to check out the NeedyMeds website and let us know how we can be of assistance to you. I'll put up my contact information here. You can reach me at lori@needymeds.org. If you wanted to order a supply of drug discount cards for yourself or for your organization, you can email my coworker, deb@needymeds.org. And if you're a patient and you need help navigating the website, or you need someone to help you find programs for your diagnosis or condition, please call the NeedyMeds toll-free helpline. We're here Monday through Friday, 9 to 5 Eastern Time. And our operators speak Spanish and English. Any last-minute questions for Ivy before we conclude? Okay, terrific. Thank you, Ivy. This is fantastic. This was just an incredible presentation. It was visually beautiful and so informative, and I learned a lot, and I think other people did as well. And I encourage everyone to check out Zero's website. It's full of information and resources and support, and they're there to help you. And if there's anything they can do or we can do, please let us know. Until next time, we wish you good health and happy days. Thank you so much, Ivy, and thank you everyone for joining us.
Thank you very much.
Thank you. Bye-bye, everyone.